Hi, my name is Sonia Almeida Santos, and I'm a charge nurse and staff nurse 3 in the cardiac intensive care unit here at Boston Children's Hospital. I've been a nurse for 20 years, with 15 years in my current role. At Boston Children's Hospital, we use the AACN synergy model, considering the needs, or in this instance, the acuity of the patient and the composition of our nursing staff. In my role as charge nurse, I utilize the ICU CAMEO as a guide to patient acuity on the unit, which in turn affects staffing decisions on a daily basis. The CAMEO provides us the ability to have a standardized language to communicate patient acuity at the bedside. The CAMEO is completed on each patient towards the end of the nurse's shift by the primary nurse caring for the patient. We do this during the day shift and during the night shift. Once the CAMEO is completed, individual scores from 10 domains of care are tallied in our EMR to produce a total score. That total score will then correspond to a complexity classification, which will range from 1 to 5 and accounts for both direct care and indirect care, and then the care that nurses provide to support the unit. Each of the 5 classifications coincides with the level of patient acuity. The ICU CAMEO Acuity tool scores greater than or equal to 3 are considered high acuity patients. This metric is helpful to understand overall distribution of high acuity patients versus low acuity patients. When scores of all patients are viewed collectively, as a charge nurse, I can take this information when deciding how to staff the unit going forward based upon the numbers of classifications 1 to 5. This is done in terms of matching the number of staff to the number of inpatient beds. Based on the Massachusetts state staffing law, we have 1 to 2 patients per nurse in the ICU setting. It is also done when creating patient assignments, matching the patient's acuity level to nursing experience, education, and certification.